Hello and welcome to Mind Matters, an invitation to well-being. I'm Sohila Bajaj. In an endeavor to highlight the importance of mental health, create awareness, eliminate stigma, and increase mental health literacy, we join forces with experts to understand the various facets of mental illness and highlight brave people who are ready to narrate their journey of hope. Today we speak about bipolar disorder, a highly stigmatized and misunderstood mental illness. According to the American Psychiatric Association, people with bipolar disorder experience intense emotional states that typically occur during periods of days to weeks, called mood episodes. These mood episodes are characterized as manic or hypermanic, that is, abnormally happy or irritable mood, or depressive and sad mood. About 0.6% of the Indian population is bipolar, according to a 1990 to 2017 study in the Lancet Psychiatry Journal. And yet, the treatment gap for this disorder is as high as 70.4%, according to a NIMHANS report, which means that the majority of patients are untreated, carrying the stigma and, as a result, suffering. This is something to be concerned about, because it is important to remember that people with bipolar disorder can be treated and can lead full, productive and healthy lives. So what can we do? We can talk about it, we can try and understand it, and we can urge everyone out there to break the barrier and seek the help they need and live the life they deserve. In an effort to do that, today we speak to Mr. Narendra Kinga, clinical psychologist, and Aparna Piramal Raje, columnist and author of Chemical Khichdi, How I Hacked My Mental Health, and as she calls herself, Happy, Bipolar and Thriving. Aparna and Mr. Kinga, thank you so much for joining us today.
Thank you, Sohila.
Mr. Kinga, I want to start with you. Can you explain to us exactly what bipolar disorder is? And also, what is it that differentiates it from the normal highs and lows or the ups and downs that everyone goes through in their lives?
Bipolar disorder is a mental health condition whereby people experience mood fluctuations or mood changes. So sometimes they may be in what we call as manic phase, which is where you have elevated energy, you have a lot of excitement, overthinking, irritability, etc., or a feeling extremely happy, positive, grandiose. And the other part is the depressive state, where the person experiences low mood or feeling sad or kind of hopeless. These are the two facets of the bipolar disorder. How are these different from normal moods? Well, we all experience happiness, we all experience sadness, and every day is not a happy day. But at the same time, we kind of adapt to changes that are happening in our environment, whether it is death in a family, loss of a job, loss of a relationship and things like that. Or you may get a promotion, you may buy a new car, you may shift to a better job and things like that. So there are always certain triggers which bring on mood changes. Also, normal moods don't last for an extended period of time. They are situation specific and they last for the duration of the thing, and it could be a week or 2 weeks, or at the most a month. In case of bipolar disorder, the duration may vary. Sometimes the other differential is that in case of normal moods, the heightened intensity is much more. So whereas in bipolar disorder, sometimes these are not really as intense as experienced in normal mood.
Aparna, I want to ask you now, you write in your book that from your first episode, so as to say, to getting your final diagnosis which of the bipolar disorder, it took 13 years. Can you tell me a little bit about your journey in the middle?
So, Sohila, as you mentioned, there was a long gap, and I had my first manic episode when I was 24, and my family and I had no clue as to what was happening because my behavior was so very different from what had happened previously. There were a number of things happening for me on the personal and on the professional front, and there were a lot of different emotions, from excitement to insecurity to anger, frustration, and a bunch of different things that triggered my episode. And we just didn't have any understanding of what was really going on. We did go and see some psychiatrists, and people said she's a borderline case, so there was no full clarity on the diagnosis. And I don't think we as a family were ready to accept the diagnosis at that point either. But we did go for a very long time to a psychotherapist, and get talk therapy. And I think that really helped us to understand some of the reasons as to why I was getting these, mood fluctuations and mood swings. But I did not accept the label of bipolarity for a long time because we were also quite reluctant to get onto medication, and that's a different story. But anyway, just from the start of, let's say, from the time I was 24 to the time I started medication, there were periods of stability which also led us to believe that maybe I don't need the medication. But finally it reached a stage where I had an episode where I was, quite psychotic. I had these voices in my head, I had hallucinations, delusions, and I was really not in control of my thoughts and emotions. And we reached a stage where, really the diagnosis was needed and the medical treatment was required. So it was quite a long journey.
You did say in your book that accepting bipolarity as a diagnosis came as a huge relief. Tell me a little bit about that.
Yes, but it came as a relief because finally we realized that it's not merely my personality that actually has a problem, but that there's a condition, there's a medical illness, there's a mental health problem which needs to be addressed, and the two are quite distinct from each other. And that when you accept that you have a diagnosis, you have some sense of how you're going to manage it. And I think that applies to people with any kind of condition, whether it's a mental health condition or a physical health. When you have a diagnosis, you have a sense of how you're going to manage it and treat it and who the right practitioners are for you. So I think it came as a relief that this is not really a personality flaw, but that this is something that needs to be managed and looked at.
Right. Mr. Kinga, like Aparna said, that talk therapy did help her initially, but eventually bipolarity is a psychiatric illness. It is a chemical disorder. So, when somebody with this disorder does come to a therapist, how easy or hard is it to recognize it?
When a client comes to a therapist, one of the things that we do is take a detailed history where we go into the life events or triggers and specific situations or moods or emotion that the person is experiencing. And we also try to have a family interview. Typically, a lot of people who, in India, unfortunately or fortunately, sometimes the family members accept and come along with the client. At other times, the client doesn't want family members to know. So the information that is given to us as therapists can be limited. And as Aparna was saying, that typically when the moods are positive or when a person is in a happy frame of mind, the concerned person may look at it as a kind of a break from the depressive state that they are experiencing. So there are different types of bipolar disorders. It's not a label, but there are categories as bipolar disorder 1, bipolar disorder 2, cyclothymic disorders. And depending on the state, many times the presenting problem is depression. So people focus on treating the depression part rather than looking at the mania part or the hypomania part. So there is definitely brain chemistry involved. But when we look at people who come to us, many of the people are kind of reluctant to get on medication. So when they come to therapy, unfortunately they have the mindset that I only need to go through talk therapy, whereas actually medication in terms of antipsychotics, if you have hallucinations, or medication in terms of mood stabilizer when your mood is going up and down, and also at times anti-anxiety, because as we find that a lot of bipolar patients who suffer from bipolar disorder may have heightened anxiety states. So medication and talk therapy together have a very, very concurrent role to play.
Aparna, jumping back to something that you said a little bit earlier, how were your interpersonal relationships at that point?
Well, I think that, it's very difficult for the family around you to understand what's really going on inside your head, and all they're trying to do is to help you stabilize. I think that I've been very lucky with my family and with my caregivers, that they have never judged me or they've never made me feel any sense of guilt or shame. And there have been many embarrassing things that I've done over these years, and I don't think that anybody has held anything against me. So I think that has been, when we talk about reducing the stigma and shame, I think these are the factors that help in really strengthening the interpersonal relationships. Of course, as we got more understanding of the disorder, I think that they are better able to look at the red flags. They're able to look at what are the triggers that might cause the situation to escalate, and they're all able to play a role in the management of the condition. So I think that the awareness has led to a better treatment and management at home amongst my caregivers, and I think amongst my friends, I think I've had just tremendous support from a lot of people. So I think that they really contribute to the day-to-day kind of equilibrium and maintaining that.
Mr. Kinga, Aparna does say in her book that, in bipolarity, the triggers are psychological, but the responses are chemical. You did earlier speak about the importance of talk therapy as well, as in conjunction with taking the right medication and getting the correct diagnosis from the psychiatrist. What are some of the useful things that people need to know about talk therapy in this process as well?
Okay. So typically when we are indulging in psychotherapy or talk therapy, the common misconception is you are actually just talking and somebody sitting there and listening to you vent it out. So it's not really vent it out. So for example, in CBT, which is called cognitive behavior therapy, which is used extensively in bipolar disorder, the therapist works towards giving the client a better understanding of their mood, their triggers, how they could have handled situations better, how to pay attention to what really their behavior is all about. So primarily the focus is on making a client understand their own specific situation. In talk therapy also the focus is on getting the family involved. So I think in India it's a very great opportunity and most people are connected to their families, and as Aparna said, her family had a very important role to play. So we have family therapy sessions where the families come and talk about what their experiences have been. And this also gives the client a better understanding of how they kind of handle certain situations and being more aware of what could trigger them. The third is even in therapy, most of the clients are focused on, we kind of work on making them more aware about their social triggers. So what are situations which work for them, what are people who work for them, and what kind of statements or comments can create negative emotions. So primarily getting connected to the family, being more aware of social dynamics, social situations, family support, peer support, friend support. I think it's not just the therapist who has a role to play. I think the entire ecosystem which is there, a part of the client's life is really has a role to play. So in psychotherapy, we focus on the individual's coping mechanisms, and that's what really it's all about.
Aparna, you then go on to say you're happy, bipolar and thriving, which is exactly what we want our audience to understand, that this condition is something that if managed well can lead to a very productive and very fulfilling life. So over the years, what are some things that you have incorporated in your lifestyle to be able to reach an equilibrium?
Yes, Sohila, I really want to offer a message of hope to anybody who might be watching this, because I think that there really is that possibility of living the life that you want to live. So over the years, I have tried to develop something called the 7 therapies. And these are just 3 therapies that I think are important for survival, which are basically the medical part that we just talked about, the role of the family, which is love therapy, which we also talked about, and then lifestyle therapy, which is just maintaining a good lifestyle in terms of sleep, exercise, nutrition, and also, an element of play and joy in your everyday life. So I think these therapies are really important to just survive. And then I think there are 4 therapies which for me have really worked to help me go from surviving to thriving. And that is the role of the allies in my life, the friends or the mentors who have really been there for me. The role of the workplace, which can actually always be therapeutic. It can also be very, very stressful, and it has been stressful for me too. But I think over the time it has become very therapeutic, and there are particular aspects of that. And then the role of spirituality, which for me has been a really important way to understand myself. And then the conversations I've had with myself, which I call self-therapy, to really understand more about the triggers and what it was that leads to the mood swings in the first place. So I think these 7 therapies are a pathway to find that mental wellness and well-being that I think is important for all of us, whether or not we have a mental health condition, and whether or not, certainly it's not restricted for people who are bipolar. It's for everyone really, and also for people who are in a caregiving role, or who are in a support role, or who are allies.
Aparna, since you mentioned the workplace, I want to ask you that in your workplace, when you told your employer or your colleagues about your disorder, was there any judgment from them?
Actually, when I told my boss about being bipolar, I was pretty nervous about it, but I had to, because I was so behind on my deadline, so there was no other choice, and I had to give an explanation for why I was not able to perform. She was actually very good about it, and in fact, our relationship has really improved since I shared that information. She went and looked it up. She said she didn't know what it was, and we were actually working remotely, so we didn't have a lot of day-to-day contact. But she herself had a sibling who had disabilities, and so she had some understanding and empathy for somebody who might be different, in this sense from the rest of us. And I think we just had a really good relationship after that. So it definitely helped, and I don't think there was any judgment. And there was no judgment when I spoke to the editor-in-chief also at the Mint when I discussed my needs. So I think I was very fortunate with both of them. I think the workplace is really the game-changer conversation, and the relationships that need to be looked at going forward.
That's really so good to hear, though, and I hope that everyone, when they share their journey, I hope they get the same support, because that is so important in one's recovery, and to be able to live with it. Mr. Kinga, coming to you now, what are some of the practices that you suggest that employees can inculcate in their workplace to create an environment that is healthy for mental illness and to promote mental health?
There are the aspect can be preventive, where we kind of focus on how employees' mental health kind of is sustained over a period of time. The other is where we start having conversation around mental health. What I really want to highlight here is that all studies indicate that 1 out of 6 or 1 out of 5 people who are currently employed are having some mental health issues. One study from the UK indicated that even currently employed mental health individuals are actually contributing about 12.1% of the GDP to the country's economy. So what we really need to understand from the employers need to understand is that you may already have a few people who may have mental health conditions or issues, difficulties, challenges already employed with your organization. And if we create an environment which is accepting, as Aparna said, which is open, which is non-threatening, which is kind of supportive, then more and more people, instead of covering up their mental health issues, will start talking about it. It's a top-down kind of an approach. So if the senior management or the CEO, or if people in the top hierarchy start talking about mental health issues or difficulties, I think it becomes easier for lower level people to accept. So I think organizations need to create different kind of situations. One is they can have what we call as employee assistance program, that anybody who's experiencing some challenges can reach out to professionals and have a chat. Second thing they can do is have a therapist or a counselor visiting the office, where privately anybody can go and have a conversation. Third, they can actually collate and collaborate with other organizations where which have done work in the field of mental health, and how they could overcome some simple challenges and things like that. Fourth could also be that we have mental health awareness programs. It could be stress busting seminars, or it could be weekend programs where people go and talk about various kinds of problems. So I think having open-ended conversations around mental health is what really needs to be inculcated, and this whole stigma factor needs to be taken care of. Moment the stigma is taken away, I think people will open up and we can actually reach out and help. I think focusing on colleagues, peers, being more supportive, being more understanding, and kind of paying attention to the fellow workers around them will help. Many times we ask somebody we meet in the lobby of the office, how are you? And we don't pay attention. But if we start asking people, how are you feeling? Or what has your weekend been like? And what was the fun things that you did? Or what did you really experience? I think people will have more open conversations. So being invested in people is what really needs to happen.
That is what we're trying to do here also. We're trying to, remove the stigma, increase the awareness and the acceptance that we all need. And Aparna, you have mentioned that one of your coping mechanisms right from the beginning has been writing. So before we go, can you please share with us one of the many beautiful poems that you've written?
Sohila, thank you so much for asking about that. It's nice to read out a poem on CNBC. It's not the usual kind of thing that might happen. Yeah. So I'll read out a poem called Turning Point, which is something that I wrote when I was coming out of depression. So it's called Turning Point. There are no headlines today, no cocktail launch parties or award ceremonies, no business class seats and frequent flyer miles. There is the private knowledge that today was a day where nothing was written which would later be regretted. That today was a day where it didn't occur to me how easy it would be to jump off a building. Today, I didn't have to dismiss the thought. Today, there's a London bus made out of a cardboard box. There is camping under a blanket strung between two wooden dining chairs in the living room. Today, there are no moments of despair, no delusions of grandeur. Instead, an attitude of gratitude, moments of simplicity and spontaneity, and the promise of purpose. Thank you.
That's beautiful, Aparna, and I have to share that I was secretly hoping that you would share this poem because I thought it was very, very beautiful once I read it in the book. And also, I think it's just a reminder for all of us to just, appreciate the simple things and the smaller things in life. And Mr. Kinga, thank you so much for joining us.
Thank you, Sohila. Thank you so much for having us here.
And on that positive note, it's a wrap on this edition of Mind Matters, an invitation to well-being. We do hope to see you next time. Until then, please do remember, the bravest form of strength is vulnerability. So it's okay to say you're not okay.